Fall is here, and that means flu season is about to begin. Is it going to be a bad one this year? Let's talk about it. Welcome to the channel. I just wanted to touch bases with you briefly about what we can expect as we enter into this fall and then winter season with respect to influenza. Well, this is really the first complete year that we've gone without mask restrictions and social distancing and some of the things that we saw during and then coming out of the COVID pandemic. As a result, we're expecting big influenza numbers this year. In fact, all the way into the beginning of September, we've already started seeing influenza cases pop up in our community, which tells us that it's going to be a long winter. Well, a lot of people think, we're coming out of COVID. Why is there such a big deal about the flu? Well, before COVID, flu was the largest killer of people as far as respiratory viruses go. And it can still be quite lethal, particularly in high-risk populations. High-risk populations being little children, elderly people over the age of 65, and people with comorbid medical conditions like diabetes, chronic lung disease, asthma and COPD, and conditions affecting the heart, whether it's ischemic heart disease or congestive heart failure. If you're in one of those categories, I strongly encourage you to go ahead and get your influenza vaccination. It won't prevent you from catching the flu, but it can save your life and prevent you from having serious illness should you contract the flu. I hope you like the content that we're putting out. If not, I would sure appreciate if you would send us some questions. Ask us what it is that you'd like to talk about, and we'll be sure to put it on the channel. In the meantime, if you are enjoying it, hit that like button. Make sure that you subscribe so that we can be in contact with you early when we put out new content, and also hit that bell notification for the same reason, so that you'll know when there's something new on the channel. It may answer one question that you haven't asked yet, and we'd like to have that conversation with you. Give us some feedback.